Michelle made breakfast. So Michelle, thank you, Michelle, for breakfast. That was very thoughtful. The sausage, the egg, everything, like a full breakfast, right? So, so I told her she can't go anywhere. Like, she has to stay with HGO. So I want to thank everyone for coming so early. We really appreciate it. We have just 5 bills on the list. So good morning. This is welcome to the Health and Government Operations Committee. This is voting list number 18. It is Friday, April 7th. And we're going to start with Senate Bill 830, and that is actually Lindsay.
Are you starting with concurrences?
Actually, yes, I should. May we do that? That would be great. Thank you for directing me. I should, and I see it right here on my paper, and I just didn't do it. So chuck it up to staying up too late.
So I have 3. The first one is House Bill 261. That is Public Projects Procurement of Construction Materials by Clean Maryland Act. The amendments from the Senate make technical corrections to terminology used in the bill, alter the definition of eligible project to restrict the application of the bill to high-performance building projects, requires DGS to consult with MDOT in establishing a maximum acceptable global warming potential of eligible materials, and most importantly, strikes a required study by the Green Building Council. This one was my error. The subcommittee in HGO intended to strike that study, and I just didn't do it when I sent the amendments off, and we didn't realize until after it had passed second reader. So the Senate is also striking that study, which was already HGO's intent.
Thank you, and it happens. You all do excellent work. So if that's the only thing you did, that is amazing. So who's is this Delegate Care? Good morning, Delegate. How are you? Good. So tell us about this bill.
Yes, it was just an error, and Lindsay caught it and fixed it. And let's see, today I will move to Ken Carr.
All right, great. So it's been moved in second. Any discussion or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, we're going to concur. May we go to the next one, please?
The next one I have is House Bill 676, Cemeteries, Pet Remains, Duty of Perpetual Care. The Senate added pet remains to the definition of interment, requires pre-need burial contracts to include the name of the pet, if applicable, and makes conforming changes. The folks on the Government Operations Subcommittee might recall that we actually did receive these amendments from the Office of Cemetery Oversight, but there was no one there from the office to speak to the amendments when we were having the discussion, and it seemed like a significant broadening of the bill that this committee wasn't prepared to undertake without having some feedback. On the Senate side, MDL and the office did come in with a letter saying that they supported the amendments and that the Office of Cemetery Oversight could handle that expansion with existing resources. So the Senate chose to adopt those amendments, and the sponsor of the bill sponsored those amendments.
All right. Delegate Kerr.
Move to concur.
Any questions or concerns? It's been moved in second. All those in favor say aye. Aye. Any opposition? Seeing none, we will concur. Go ahead.
The last one I have is House Bill 816. That is Procurement Minority Business Enterprises and Veteran-Owned Small Business Enterprises Participation Goals Scorecard. The amendment is just a technical change.
Okay. So it's just a clerical change. May I have a motion? It's been moved in second. Any questions? Seeing none, all those in favor say aye. Aye. Any opposition? We will concur. Is that it? With the concurrences, or we have more?
I don't have any other concurrences.
Okay. All right. So Lisa.
Yep. So I have 2.
And good morning, everyone.
Good morning. So the first one I have is House Bill 103, which is the social worker examiner temporary license to practice social work. I believe we're going to not concur with the Senate amendments that put back in the conditional and temporary licenses. And you had assigned Cullison, Woods, and Hutchinson to the conference committee.
Yes. So Right. Is there a second? It's been moved and second not to concur. Any discussion or concerns? See none, all those in favor say aye. Any opposition? We will not concur. Next.
And the next one I have is House Bill 571, opioid restitution advisory council and fund and overdose response program. The amendments specify that MDH must allow entities to choose the formulation or doses of an opioid overdose reversal drug, subject to the limitations of the state budget.
Okay. Is that, whose bill was that? Was that Delegate Kerr in your committee?
No, I think it went to Delegate Collison and it's
Delegate
Delegate
Collison.
Kiki as the sponsor.
Okay.
I'm not familiar with the amendment, so Lisa, can you tell me again what the amendment does?
It's just saying that it's subject to
Oh, subject to
budget.
budget, that's right. I would move to concur.
Okay, great. And I have to say, I did talk to Nick about it because it was his bill. Now it's coming back to me. And I did call the Department of Health because I wanted to make sure that this is not an excuse for them not to do it. And they actually sent us an email last night. I asked Marie Grant to send us an email that basically says that, you know, that's not their intent. And she told us on the phone that their intent is to go ahead and do it, but they wanted to make sure that it wasn't going to get, you know, out of control, the expense. So Nick feels comfortable with that. I feel comfortable with that, especially because we have an email. And I know Marie, so I trust her word. So I will move to concur. It's been second. Any questions or discussion? Seeing none, all those in favor say aye. Any opposition? Seeing none, we will move to concur. Anything else? That's it for concurrences, correct? So let's go.
That's all for me.
Thank you, Lisa. Have a blessed day. So we have Senate Bill 830, which we are secondary. And this is Lindsay, and this is the Environmental Health Specialist in Well and Septic Systems Permitting Studies, Environmental Health System Support Act of 2023.
This bill requires 2 studies related to environmental health specialists and well and septic system permitting. The first study requires the Department of the Environment and Department of Health in consultation with the Board of Environmental Health Specialists to conduct a study on staffing needs for environmental health specialists in local health departments. The second requires MDE in consultation with DLS and the University of Maryland Agriculture and Food Systems Extension Program to study the implications of the delegation of MDE's well and septic system permitting authority to MDH. And they must submit an interim report of findings by December 1st, 2023, and a final report by December 1st, 2024. Our folks that followed this bill were delegates Morgan, Bongdari, and Woods. And the vote in ENT was an ideological vote. The reason for that, as I understand it, I can't speak specifically for the members, but there were some amendments suggested that would have required that second study to be contracted out to a third party rather than have MDE do it. And the committee opted not to go that route because of the cost implications of having to contract with a third party.
Okay. Is there any discussion from the committee? Yes, Delegate Chisholm.
Do we know if MDE can even handle it?
That we've been told that they can do it with existing resources.
Okay.
Thank you for the question. That's a good one. Any other concerns or questions? Delegate Hill.
Thank you, Madam Chair. I just wanted to ask the 3 members who went to the hearing, was there anything of concern from our committee standpoint that they heard during the hearing?
Yes. Yes, can you tell us?
Yeah.
Thank you, Delegate
Yeah,
Morgan.
when I went to the hearing on the septic bill, I was fully ready for a fight because most of the time septic issues that really impact like areas mine are not really good for us. But I was actually happy with the hearing. I mean, I think it's a good bill. Look, and as a real estate guy, I've had firsthand experience. You know, county for county, the process for getting any type of perk test or septic inspection varies greatly. So it does need to be kind of streamlined and put in there. So, yeah, I'm going to support the bill. I thought it was a good bill.
MDH, so the amendment is letting MDH do the study now instead of a third party.
Yeah, I don't know. That really takes away from the bill, I think.
But
Because
it's
the problems, any problems with permitting, I mean, MDH has control over this process from start to finish. If they really wanted to fix the problem, they could do that any time.
And I think is that, it's a new secretary, and I think that she wants to do everything slowly, but I see that doing this is not killing it.
That's
It's
true.
just getting the facts so she can justify doing it later, so.
Yeah, my personal experience dealing with this, I just think that the way MDH's business model is, they kind of let each county's health administrator kind of do it on their own.
Yeah.
And then, like, the environmental health is in a different department than
Yeah.
other things. And it just seems like the directors of those health departments for the deal with perk tests and septic systems have a wide authority to kind of run things themselves, which can be good, but it can be bad, and it's really confusing for someone that's operating in multiple counties to kind of know the niche of each county. So,
Yeah, and what the rules are. But I think that this is a way for her to really understand the issue.
Yeah.
And I have met with her, not about this bill, but just in general, and she really wants to learn, all the different systems and everything we're doing. So it's just a matter of coming back next session, and seeing what the results of the studies are. But at least it's being looked at. But I understand what you're saying, because it's a problem. Delegate Shalega.
Thanks. I guess this would be for Delegate Morgan, since you were at the hearing. So, the concern that I'm sure the minority party that voted against it would have is that people who sit in offices make these rules who largely live inside the URDL, not outside the URDL. And so they're making very punitive rules that have historically not worked out well for people in septic areas, which is a good part of my district. So, I mean, why wouldn't they make a study that would turn out some rules that would be terrible for people in rural areas?
Well, I view this bill as not only just, I don't think they're doing so much a study on whether septics are good or bad. I viewed the bill as, maybe I'm misinterpreting the bill, I viewed it as a study of whether it's really the process of getting a permit. Am I
That's
wrong on
right.
that?
That's right.
Yeah, so.
And Lindsay, correct me if I'm wrong.
Yes, that's right. So it's MDE studying whether or not to delegate the well and septic system permitting authority to MDH.
Ooh,
So the study is MDE in consultation with
scary.
DLS and the University of Maryland Agricultural and Food Systems Extension Program.
So why wouldn't they just give it to MDH, Delegate Morgan? And that's not good.
I'm not sure that's not good, because MDH has to weigh in on that now. There's all kinds of different requirements for when you drill a new well, how far it has to be from the house, and all these other requirements. And because I've worked with constituents to get, exceptions to those rules. I don't know. I tend to think that the bill had to deal more with just making sure it was uniform across the whole state, which I think would be a benefit.
Thank you.
And I think that it's fair to say that that will be part of the equation.
Extremely cumbersome, dealing with septic and wells.
Yeah.
I can tell you, personal experience, it's so different in Charles County versus St. Mary's, and then Calvert. Calvert's probably the most strict, and I've had tons of constituents ask me, like, why is this a different requirement? It's the same regulations, and it seems like the health department just has a wide latitude to make decisions there. It would just be easier if it was more uniform.
Yeah, thank you. Delegate Bagnell, and then Delegate Hill, you have another question? Okay, 1 second. Let me go on to Delegate Bagnell, who has not asked a question yet.
Thank you, Madam Chair. And I really appreciate Delegate Morgan, you speaking to the bill, because I also, from the Broad Neck Peninsula, we also have our challenges with the whole process. And am I correct, this is also about sort of streamlining and also putting it under the right authority, but also looking at staffing to make sure that we have adequate staffing? Or this is maybe a question for Lindsay as well.
So let's
Yeah,
allow.
so there's two studies. The first one is on staffing needs for environmental health specialists in local health departments. And then the second study on the delegation. Also, in the details of that study, it says that they should be studying the optimal long-term staff organization structure to best address issues of delays, communication, and customer service. So both of them have like a staffing piece.
Okay, thank you. Thank you very much.
Okay, great. Delegate Woods?
So, thank you, Madam Chair. I think to Delegate Morgan's point, I am also concerned that we do need a centralized system, especially when you talk about different rules going across different counties. And you made the point of some people wanting an exception. How does that impact when you have, exceptions made in one county and then perhaps they're not being made in another?
So I can tell you, well, that's my point. The exceptions aren't made by the county. The exceptions would have to be granted from the local health department, and those exceptions to the rule are sometimes arbitrary.
Right.
And I'll give you a great instance so you better understand the situation. I had a constituent in my district build added onto his house without a permit. And what he did was he built over, like right next to his well. So in the state law that you need a minimum, I think, of 50 feet from a well to a building. And which honestly is probably excessive. That's probably too much. But look, there needed to be a compromise. We ended up getting a variance of I think 30 feet or something. And he ended up having to tear down and move part of this building. But that might have been granted differently in a different county or, who knows, but it would be helpful. But ultimately, it was the health department that made that decision. So,
But this is what the study will look at.
yeah.
Right.
Right? The study will look at everything that you have described and come back with recommendations. It's
If anyone's ever,
precisely that.
I know that septic is like this big mysterious thing, but when they do a septic test, I mean, it's pretty archaic science. If you ever watch one, they take a backhoe and they dig down until they hit water. That's the water table. You got to come up 4 feet from the water. So let's say you hit water table at 15 feet. So you got 11 feet. You got to be 2 feet below the soil. Somewhere in there, you have to find some permeable soil. So they dig a hole right next to it where you think the permeable soil is. They'll dig it down. Let's say that's at 7 feet. And they'll knock a 20-inch piece of steel, like a circular, like a pipe, into the ground. And then you fill it up with water. They'll drop a ruler or a 2x4 with some nails in it every inch, and everyone sits around a hole and waits for the water to drain. That's a perk test. So honestly, there's some variable and judgment calls there that can be made, and I think it would be helpful if it was uniformed.
Delegate Hill, then Chisholm.
Thank you, Madam Chair, and thank you, Delegate Morgan. That was very helpful. So I just wanted to make sure my understanding is correct. Lindsay, the first study is the Department of Environment, the Department of Health, with the Board of Environmental Health Specialists, and they're looking at what the educational and licensing requirements are, the competitiveness of wages, and the feasibility of establishing apprenticeship programs. The second study, where they took out the independent, added the Department of Legislative Services, which our experience is that they do a pretty good job of coming down on departments and telling them when they're out of line and reporting back to us pretty honestly about what the shortcomings are. And that study is about the benefits and issues with the existing system and lessons that can be drawn, optimal long-term staff organizations. And so they're getting it, we're secondary, so.
We are, and they
we should
voted it
be-
out already.
Right, so I'm thinking we should be voting yes, because from what Delegate Morgan is saying, this is a necessary study, and Legislative Services is a group that at least I've found I can depend on. Am I understanding the bill correctly, Lindsay?
Yes, that's it.
Thank you.
Yep, and then the last comment will be Delegate Chisholm, and then we're gonna move on, okay? Because we're secondary, they voted it out already.
That's fine.
And we heard good things from.
And I'll make it
ahead.
quick. And
Yes.
I love my friend Matt Morgan, and he's sold a lot of houses, and I've built a lot of houses, which makes a big difference. I don't like the idea of it being centralized, but I'm gonna tell you why. Because if you look at the state of Maryland, the soil on the eastern shore is completely different than the soil in western Maryland. When you dig a well, you have to go through what's called an aquifer, and then depending on where you sit in this state, changes dramatically. And then where they put that septic system, so they work in unison. If it's well and septic, septic can't be near the well can't be near the house, so it's almost like putting a puzzle together. But it varies drastically depending on where you are in this state. Western Maryland is much different than Eastern. Anne Arundel County is much different than even Baltimore County because of the soil that we all sit on changes.
But they're not talking about specifications.
I think this study will be fine.
They're talking about the internal process is how I viewed it.
Yeah, but they're gonna look like exactly what Delegate Hill said. They're going to look at what you're describing precisely, right? Like what the system is now, why isn't it working? What can we improve? That's exactly what they're
Yeah,
gonna look
I'm
at.
trying to think of because I know the committee voted on it. I'm trying to think where I was wrong on this, but I thought they were looking more, the entire bill was just
Be the
looking at
first
the
time my
internal
good friend Matt
process.
Morgan has pushed for bigger bureaucracy to fix a problem.
It's not a bigger bureaucracy, it's just
I'll leave it at that.
All right, we're gonna move to concur.
No, move favorable.
Move favorable? No, move favorable? Is there a second? All right, all those in favor say aye. Any opposition? All right, I have Delegate Shalega and Delegate Riley and Delegate Chisholm, okay? And we are very interested in this report, Lindsay. So when it comes, can you make sure that every single member gets it, okay? Thank you. Thank you. All right, so I love the discussion. Let's move on to House Bill 363, Maryland Health Benefit Exchange and Maryland Department of Health Care Coverage for Undocumented Immigrants report. This is favorable with amendment. Lisa.
This bill requires the Maryland Health Benefit Exchange and the Maryland Department of Health to develop a report comparing options for offering affordable health care coverage to state residents who are ineligible for Medicaid, the Maryland Children's Health Program, or qualified health plans due to immigration status. The exchange and department must report their findings and recommendations to specified committees of the General Assembly by October 31st, 2023. The amendment requires the study to also include an analysis of offering dental coverage.
Okay. So this is actually Delegate Collison. And I want to remind the committee, like we were one of the early states that actually created the Maryland Health Benefit Exchange. Before we created the Maryland Health Benefit Exchange, our uninsured rate was actually, it was a little more than 14%, right? We have 6 million people, a little more than 6 million now in Maryland. So we had like more than 756,000 people that were uninsured. We have 23 counties in Baltimore City, 24 jurisdictions. After we created the exchange, people had insurance all over Maryland, right? We reduced that uninsured rate by more than 50%. And we also did, this committee also did the subsidies for young people. We actually did the reinsurance program, right? We did the check the box. We done a lot, but who is left? We have about 350,000 people that are left uninsured in Maryland. It is estimated that a little more than 100,000 of them probably qualify for Medicaid and just haven't, apply or other subsidies. And there are about more than 275,000 that are undocumented. By that, that means people that are not here, do not have legal status, but also people that are dreamers and that are in the process as well, right? So it's not everyone in the same status. So last year, the Hospital Association reported that they actually spent like $150 million in uncompensated care at the hospital, in ER. 150 million for this population, because this is where they go to the ER. When you think about the wait time, right? And you think about that this is where they go to get their care, that's where they're going, right? As well. So this is a study, and I'll let Delegate Collison, because it is her, she's the sponsor, describe, why this is important. Just because when we think about our waiver, which is very unique, our total cost of care model, which we're going to be negotiating in 2 years, and we're not doing that well with it. So we're going to have to really prove to CMS that we can do better than that. This is a big factor in the fact that we're spending so much to cover this population. So Delegate Collison.
Thank you, Madam Chair, and I think you just made the most compelling point, which is it's really important in this state for not only for individuals, not only for the people who don't have health insurance, but for the state itself, because economically, it's to our advantage to have everyone in our healthcare roles. We've spoken enough about this in this committee to understand that the more people you have insured, the less you're going to be spending on uncompensated care. So what this bill does is it speaks directly to the folks who who are eligible, who are economically eligible or potentially economically eligible to receive Medicaid, but can't, as the chair just said, because of restrictions around immigration status. And both the health department and the exchange have agreed that this is an important study to have, and that they want to dig deep into what kind of options could be created in order to help us meet the needs of that population. So this is just a study, and they would come back to us with a report and recommendation, at which we will be able to have in order to make informed policy decisions. So with that, I'd like to move the amendment to include the dental plans.
Second.
Okay, so it's been moved and second, and I'm going to open it up for discussion. I have Delegate Chisholm first.
Thank you, Madam Chair.
My pleasure.
In this study, can we, since it's always been talked about that we have X amount of dollars that are going uncompensated by the hospitals, and I'm assuming we can get that number from them. Can we also, I don't know what else is in the study because it's not my subcommittee, find out, okay, let's say that they...
Can I answer that for you? So the hospitals have those numbers and they have a report.
Okay.
And I have it, that I can send it to you. Actually, Michelle, can you make sure that the committee gets it?
Yeah, because that would be great to know in some of the...
Absolutely.
And then to find out if we were to put this into law and give them coverage, what would be the savings? And I know that you have to project a little bit, but that would be a pretty important piece of information to have to say, look, this is what it's costing now, the hospitals in the state of Maryland, if they are covered and assume they pay.
Yeah.
What would be the savings if we did it that way? And I know it's a complex as you're kind of projecting what might happen, but.
Absolutely.
Thank you for the question, Delegate Chisholm. Our healthcare exchange is extremely good at those kinds of projections. They've done really intensive studies around the impact of different kinds of programs. The Young Adult Subsidy Program, they were able to project, and they came pretty close. They've got like amazing actuaries. I don't say this lightly, but I think Maryland has one of the most effective healthcare exchanges in the country. So I trust the healthcare exchange to actually get that data for us and have those projections indeed as part of this study, because we want to make sure that it's meeting a multiple set of needs.
And when's the study due?
It's December, isn't it? Lisa, or is it a year?
Lisa, when is the study due?
October 31st, 2023.
Oh,
So this year.
October. Yeah.
Yeah.
I'd be interested to see this study.
Absolutely. We'll make sure, again, you know what, we get the reports. Michelle, I know I get them, every report that we get, because we have been trying to do a little better at tracking all these reports. Every report that we get, can you make sure that the entire committee gets it in the interim as they come? Okay? And for the committee, those are great sources to look at possible legislation if it's a topic that you agree with, because oftentimes they have recommendations in them. Delegate Bandari.
Thank you, Madam Chair. Yeah, I'm looking some data from fiscal perspective, and these immigrant workforce that comprise of 6%, and they paid an estimated over $373 million in federal taxes and over $242 million in state and local taxes in 2018. They are also contributing to our economy.
Yeah, but this is, and thank you for that, but this is a way to just do it in an intelligent manner, right? Just to look at all the facts and to see what's a good way to relieve our system, because, you know, at the end, I feel, and this is just my feeling, that we're gonna need to make some serious decisions in the next 4 years about healthcare in this state. And we need to, we have been doing a lot, but it's piecemeal. And we're going to need to come up with a holistic way and something permanent as well. Delegate Bagno.
Thank you, Madam Chair. And this is probably more of a comment than a question, but I just wanted to say thank you for the amendment because the dental was a priority it was a recommendation of the Oral Health Task Force. It was a priority of the Maryland State Dental Association. And it's part of the nexus of the challenges we're having with the dental ORs as well. So I just wanted to say, isn't that so?
And we are allowing it because it's almost the end of session. Go ahead, Delegate Taveras.
Thank you. And good morning, everyone. I just want to make sure that I'm clear the information we're collecting. We're not just, I think it would be good to see not just the amount of money that is uncompensated care, but how much is also being paid by those that are uninsured, right? Because the thing is that oftentimes these people that are paying under duress, and they don't really have the income to be paying, but they're finding the money regardless to pay in so that they are, you know, not in debt because they feel personally responsible for these funds. And so I just think that that too should be incorporated in the report. And juxtaposing that with the demographics of the income bracket that these people are in.
We have Delegate Taveras last year and the year before. This committee has been doing a lot of work, Delegate Sharkoudian, regarding hospital debt. And that information we have already. And we passed some laws that, because Maryland requires charity care, right? And we did a study about who was being offered that, what were the limitations, and we put things in place, and we can get that to you. So
that would be helpful.
That's a separate issue, yeah.
Yeah,
and,
that is, because
yeah.
my concern with that was that there, as you saw, we had a bill here this year that people paid that really shouldn't have paid.
Right.
Right.
But, yeah. But we have already looked at that, and we can give you that. Actually, Michelle, if you could get those bills and send it to, actually, the whole committee, because there are 8 new people about that, because it's a good thing to tell you, the people back at home, that if they have medical debt, that they can seek charity care from the hospitals, or a payment arrangement, and it's based on income. And this committee worked on that, okay?
And I just want to make one other point, and I'm sure you're probably well aware of this as well, that, and this is just more of a comment, that given that we had such an issue within our county with uninsured, our basically our medical system went into bankruptcy because of this. So this is a real issue that we must face, and so I'm just a little bit verklempt why we're not moving forward this particular term on this. But anyway.
Okay, thank you. So anyway, I see no other comments on that. Is there a motion?
Move the amendment.
It's been moved in second. Any other concerns? Delegate Hill.
I'm sorry, I guess I got confused. So this is a study, does the bill that we have to allow people to buy in, is that related, unrelated?
That is
or
separate.
that's
That is separate, and that is in the Senate. We moved it, and the Senate has not done it.
Okay.
And they're very separate issues, because that's already a tool, and actually, it's been studied. This past summer, this committee requested the Maryland Insurance Administration, Ben Steffen and his shop, the Maryland Healthcare Commission, and the Maryland Health Exchange to look at this population, and that was one of the recommendations. And there are all these other studies they have recommended for the Maryland Health Benefit Exchange to be opened with no subsidies and to seek a waiver, and that is in the Senate.
So we can act, so that's how we decided to subsidize for young people.
That's
how-
correct.
Right, and so this is about what else do we need to do, and let's make sure that we're thoughtful about it.
That's right.
Okay.
That's right. It doesn't, commit us to anything, but you get the facts. Any other questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Delegate Shalega, Delegate Chisholm, Delegate Morgan, you owe Morgan something. Delegate Morgan? This is on the amendment. This is on the amendment. Oh, the amendment's fine. No opposition to the amendment. Okay, so it passes on the bill as amended.
Move the bill as amended.
It's been second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition, will you kindly raise your hand? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, and Delegate Hutchinson. Thank you. And thank you, everyone, for the civil discussion. Really appreciate it. So the next bill is the same. Can we just do it again? Without just move the bill? It's favorable. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition, kindly raise your hand. Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson. Thank you so much. Let's move on now to Senate Bill 914. And that is actually testing for fentanyl, and that is Aaron.
This bill is identical to its cross-file, which was unanimous in HGO.
All right. It's been moved in second. All right. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. I want to thank the family. They sent the committee these beautiful flowers that you see as you enter the committee. And they're beautiful and, has his essence. They smell so pretty. And I want to thank the family for that. And we really appreciate it, and our prayers are with you. We have House Bill 283, Mental Health Law Assisted Outpatient Treatment Programs. This is favorable with amendment. This is Aaron and Bagnall. Aaron, can you please tell us what the bill does?
Sure.
Thank you.
This bill is enabling legislation for counties to establish assisted outpatient treatment programs. The bill sets forth the requirements for the petition, defines who is eligible for the program, including specified criteria and the minimal services to be provided, and sets forth the court process, including notice, requirements, and timelines. So you have a reprint of this bill, which is the work of the House Bill 823 work group, which provided unanimous support for the bill. Beginning on page 2, after line 12, the bill amends the Office of the Public Health Defender statute to require the office to provide representation in outpatient treatment proceedings established under the bill. From the bottom of page 2 through the top of page 4, language related to the involuntary commitment proceedings is struck from the bill. 106A01, which starts on page 4, lines 9 through 18, provides for the definitions, including the definition of serious and persistent.
And one second, Aaron, you have,
Since, yes, page 4 of 12. Right, so look at the top right.
one second, the top of the page, right? Look at so it will be page 6, you do have it, it's in here. So it says, the bill page says, 1 minute, please. The bill page says page 4, and the bottom says page 6. Okay, so when she references to it, just, look at the top, okay?
Correct. I'll be referencing from bill page.
Bill
which is at the
page.
top.
Yeah, at the top. And thank you for the question. Go ahead. Go ahead.
So bill page 4, lines 9 through 18, provides for definitions, including the definition of serious and persistent mental illness and treatment plan, and requires a treatment plan to include at a minimum case management or assertive community treatment services and peer support services. Sorry. Sorry, my computer.
It's okay. And I have to tell the committee that there was a subgroup that worked really hard, you know who you are, with Aaron and I, and there was a lot of work and a lot of meetings, so thank you.
Okay, I've got it. So beginning on line 20, there's 106A02 that authorizes a county to partner with another county to establish an AOT program. It provides that the AOT program is only available to residents of the county or counties that establish the program, and requires the approval of the local behavioral health authority for the county that will also provide oversight for the program. 106A03, which is on page 5, line 22, sets forth the requirements for the petition for AOT, and amendments have been added after line 23 that requires the petition to be filed in the circuit court in which the respondent resides, and a requirement that the court notify the county attorney and the office of the public defender of the filing of the petition. There's also a requirement that all rules of civil procedure apply to the cases, that the requirements of the subtitle do not abridge certain rights of the respondent, and that petitions filed under the bill are sealed and are not to be published in Maryland Judiciary Case Search, and that participation in AOT may not be used against a respondent in subsequent legal matters. Starting on line 24 of the reprint, 106A04 authorizes the court to order the respondent to receive assisted outpatient treatment on a finding by clear and convincing evidence that certain factors are met, including that the respondent is at least 18 years old, has a serious and persistent mental illness, has demonstrated a lack of compliance with treatment for the illness, that has at least twice within the 36-month period immediately preceding the filing of the petition been a significant factor in necessitating inpatient admission to a psychiatric hospital or the receipt of services in a correctional facility, or at least once within the 36-month period before the filing of the petition, resulted in an act of serious violent behavior toward self or others, or patterns of threats or attempts at serious physical harm to self or others. The respondent is capable of maintaining health and safety in the community with appropriate supports, and in view of the respondent's treatment history and behavior at the time the petition is filed, the respondent is in need of AOT to prevent a relapse. The respondent is unable to adequately adhere to outpatient treatment on a voluntary basis in the immediately preceding 36-month period, and in view of the respondent's treatment history and behavior at the time the petition is filed, AOT is the least restrictive alternative approach to maintain the health and safety of the respondent. The bill also requires the court to consider an individual's prior failure to adhere to a treatment plan entered into voluntarily when determining whether to order the respondent to receive AOT. Moving on to section 10-6A05, this sets forth the requirements for the treatment plan. So after line 3, it provides that within 10 days of the filing of the petition with the circuit court, the care coordination team must develop a treatment plan, and it requires that any mental health advance directive to be honored. It gives the respondent the opportunity to enter voluntarily, and it requires, if the respondent enters voluntarily, notification to the court that the parties are dismissing the case and the filing of the stipulated agreement that the parties are dismissing the case. Moving on to section 10-6A06, this outlines the court hearing process. In line 23, this requires that a hearing be scheduled not later than 30 days after the petition is filed by the court. And line 30 requires the Office of the Public Defender to represent respondents if they cannot afford an attorney or if they are unable to obtain an attorney due to their mental illness. Moving on to page 6, this strikes language that would have authorized the hearing to be conducted in the respondent's absence, and the bill requires the petitioner's presentation of evidence to include the testimony of a psychiatrist who examined the respondent within 10 days before the date of the petition, and from a psychiatrist to explain the treatment plan, and requires the psychiatrist to have met with the respondent and have reviewed the treatment plan. Moving on to page 9, 10-6A07, bill page 9. 10-6A07 authorizes the court to order the respondent to comply with the AOT for a period not to exceed 1 year. 10-6A08, which starts on page 10, sets forth the court process for when there are material changes to the treatment plan, and amendments in line 14 through 16 require a court to respond to a motion for a material change to the treatment plan no later than 30 days after receiving the motion. It also requires notification to the court and to the parties to the case if a psychiatrist changes a respondent's treatment plan when circumstances immediately require that change. Now 10-6A09 requires certain language related to the emergency. It actually strikes certain language that in the bill as introduced related to the emergency petition process. So after line 7, there is language that has been added that requires notification to the respondent's care coordination team if a petition for the emergency evaluation of the respondent is filed, or if the respondent is subject to other court involvement. And then after line 16, there is language requiring a county to submit to the local behavioral health authority a plan for periodic meetings with the court during the respondent's assisted outpatient treatment. 10-6A10 provides that within 10 days before the expiration of an AOT order, the respondent's care coordination team must provide the respondent with a plan for continued treatment if considered necessary. And then 10-6A11 provides for specified reporting requirements for AOT programs, including information on program statistics, demographic characteristics of program recipients, information of diagnoses, services offered, significant life events of recipients, recipient outcomes, and a survey of recipient satisfaction with the program.
Okay. All right. Okay. So I am going to, this bill here has never been able to pass any of the houses. The opposition has been fierce. We heard during the testimony that 47 other states in the District of Columbia do it. We have heard testimony from families that have come to this committee begging to have some relief. And I want to thank the subcommittee, the committee, and Aaron for their work. Even though it's late in session, it is important that we start moving something and set the framework. Because again, this is another tool in the toolbox when it comes to behavioral health. And we have done a lot, and you're going to see a report that is going to come out of this committee and the General Assembly on the work that this committee particularly has done this session on public health and behavioral health. And we spent a lot of money. And this is a good way, in my opinion, to be able to look at the person in a holistic way with services in the community, right? As well. I just want to set the framework for the committee. Usually I don't give my opinion. I let you guys do the discussion. But, you know, we have been here for a little while and have seen this come up. I'm going to open it up now, if I may, from the work group. I'm going to Delegate Woods, Delegate Bagnall, and Alston, Hutchinson, anyone that was part of it that would like to talk about the process and why you came up with what we have in front of us. Who would like to go first? Okay, sure, Delegate Bagnall.
Thank you, Madam Chair.
And then Delegate Woods.
This is a bill that the Assisted Outpatient Treatment Work Group has been working on diligently since crossover. And I said I didn't even want to call them the opposition because we were all trying to do the same thing. But we worked with all of the stakeholders and tried to thread the needle of making sure we didn't have to wait till somebody decompensated to the point where they were in a crisis situation, where family members who were seeing, you know, this person getting sicker had a way to intervene, but where we were also holding the counties accountable, holding those local behavioral health authorities accountable to providing those services, to ensuring care, to setting folks up for success in treatment. We worked with the Office of the Public Defender to make sure that we were to the best of our ability.
And for the record, I called on you first, and I know I saw Delegate Woods because you're the chair of the committee and you're taking the bill to the floor. So I start with whoever chairs the committee, and then I'll go to the member, okay? Go ahead.
Thank you, Madam Chair. And we work with the Office of the Public Defender to make sure that we were protecting folks' civil rights to the best of our ability, but also their right to be healthy. And I think we have struck a balance with this bill, and every member of the work group contributed. I mean, there were Aaron was doing yeoman's work, just going through the volumes of data that we were getting and information, and looking at how other states had approached this and how they had tackled this. We had members that were working with the Office of the Public Defender to make sure we got the legalese right, because I'm not a lawyer.
Can you tell us who the members were?
Mm-hmm. So Delegate Alston was working directly with the Office of the Public Defender. Delegate Moon, Delegate Hill was bringing us the perspective of physicians. Delegate Hutchinson, Delegate Johnson, the Delegate Kipke, Delegate Martinez. They were all bringing really good information to bear and considering this very carefully and thoughtfully, and so I put it to the committee. I think we have a really good effort here that will bring some relief to these families, will provide services, and also ensure that we're protecting the rights of our Marylanders, while also making sure that they're getting access to really necessary care in the community. They're not ending up in the hospitals on a rotating cycle. They're not ending up in the jails on a rotating cycle. And they're not ending up in the morgues, which is generally what the biggest fear is for these families.
Delegate Woods, and thank you,
Delegate.
Delegate Bagnall. Delegate Woods, I saw Delegate Woods.
Thank you, Madam Chair. So I actually wasn't a part of the work group. And I fully support the AOT program. I think it is extremely necessary. I have a question, though, because I got a call, and it hit me that this would be something that would be impacted. I got a call from someone whose son has pervasive mental health challenges. He was arrested in Prince George's County, and they somehow made him a Prince George's County resident, but he wasn't. They said he was homeless and then determined him to be a Prince George's County resident. And his father called me and he was like, I don't understand how that happens. He gets all his benefits in the District of Columbia. He's a resident of the District of Columbia. But they just determined that where he was arrested they said he's homeless with no and so I'm wondering if that's been considered, if that would be a situation that needs to be addressed, since it's going to be based on the county where you are. That was the question.
And it does. So I think Erin's looking for the page where it speaks to residents or last known residents. So if somebody is.
Erin, do you have the page, the reference in the bill?
Yes, I can. So the filing would be in the circuit court for the residents or the last known residents. It's definitely in the bill.
You said it's.
Page 5, after line 23, letter D-A.
Bill, page 5?
It's bill page 5. On your package, it's page 8, after line 23, letter D-A.
Okay. Okay, so it's there.
She's got it. She's amazing.
Yep.
Is there, hold on one second.
Bill
So we
page
have,
5, after line 23.
okay. All right,
it's
Delegate
the-
Woods? Yes, thank you. Okay, thank you. Delegate Hill?
Delegate Woods' example, I think what's slightly different here, right? So you gave an example where my understanding is police pick someone up, no ID, they've seen him around, they decide he's homeless, therefore we're going to make him our resident. And the father, family member saying, but he actually has a residence. They have no way of knowing that. This is petitioned by someone who is intimately involved with the person, right? So it's a little bit different. And there's also some room for regulations to address how do you establish, but I think it's really the sworn under perjury of the petitioner to say this person, last known address was in this particular jurisdiction. It's a little different.
Okay, and next I saw Delegate Martinez, followed by Rosenberg, followed by Kaiser.
Thank you, Madam Chair. I want to thank you for the opportunity to work on this bill. I have a sibling who has severe mental illness and had to go through something similar to this in the District of Columbia, and now is able to live a very independent life because of the services that they're able to receive. So this works. I know it works. I think the bill and the work that we were able to do strikes a balance of being able to provide care to those that don't necessarily know they need it, but also respecting their civil liberties. And I really want to just shout out Chair Bagnall as well as Delegate Austin and Hill and this bill sponsor for bringing their expertise to bear on this bill. I learned a lot, and I really do appreciate the work collaboratively we were able to do. So thank you.
Thank you. I have Delegate Rosenberg, followed by Kaiser.
Thank you, Madam Chair. It seems that 30 days is a magic number in the bill in terms of review or steps in the process. I'm just curious, I'm not being critical. How did you come up with, or what led to that 30-day status?
That was actually on the recommendation of the Office of the Public Defender, because it was enough time and also the Mental Health Association of Maryland, because it was enough time for the court process. It's fairly standard for court process, but it also is enough time for the respondent to do a challenge of a petition. It's also enough time for there to be a treatment plan considered and for voluntary treatment to be offered. So we didn't want it to be overly burdensome to the court system, but we also wanted to make sure there were opportunities within that time frame for the legal process, for a response from the respondent, for voluntary, for a treatment plan to be crafted, and for voluntary treatment to be offered and considered.
Delegate Hill. Oh, no, Delegate Kaiser, followed by Hill.
Thank you, Madam Chair. Aaron went through all the amendments, and I trust the subcommittee process and all the work that you did, and I heard the word balance, but can you give an example of something that was done to try to balance the needs? A specific provision or two that you did?
One of the biggest additions to the bill was the civil process, which was spelled out, and we wanted to make sure that we were ensuring that assisted outpatient treatment did not alter the petition process and the civil rights process and the court process. Another change that we made from the original bill was that at the 30-day point, at the 1 year, 30 days from the termination of, or the expiration of the court order, the bill originally came in that the petitioner could petition the court to continue the order. But the petitioner isn't a health provider. And they're not necessarily, though they are aware of the treatment, they're not necessarily part of the treatment team. So we didn't feel it was appropriate that somebody with a legitimate interest could sort of petition in perpetuity. So that's why it's the behavioral health team, it's the care coordination team that is making those recommendations, that is creating a treatment plan. And another addition that we had actually from our conversations yesterday was we also didn't want the offer of voluntary treatment to then be used to continue this cycle. So we created a process whereby if they accepted voluntary treatment and then didn't actually do the treatment, that could be considered in a future petition, and also that there was a court process where the court would be notified if they failed to do voluntary treatment, and then they could go to assisted outpatient treatment. But it's that balance of trying to compel without the courts before we have the intervention of the courts.
And Madam Chair,
Absolutely.
just very brief follow-up. The opponents to this legislation who hated the original, do they still hate it, or do they just dislike it less? I'm just, and that doesn't change my support for the bill. I'm just curious.
Again, when we talk about striking a balance, nobody loves it. Nobody loves it. Even the proponents of the bill don't love this version of it. They would actually have preferred it was more broad.
Okay.
Because we tried to limit it, again, 23 years. 23 years we've had this bill in some form in this body. So this is a baby step, but we're trying to make sure that we are giving some relief to these families, and also giving people a path to their own, autonomy, but also knowing that some people are simply too sick to recognize that they're sick.
Delegate Hill.
Thank you very much, Madam Chair, and thank you for allowing me to be part of the work group. And I want to thank the bill sponsor and the work group chair and subcommittee chair for really great diligence in getting this done, and all the members, particularly, everyone contributed, but I want to particularly shout out Delegate Austin for bringing her very clear and specific legal expertise to bear.
You're taking my thunder. I was going to speak about her when we're done.
That being said, I think there are a couple of things, and then I have a couple of small suggestions I'd like to consider amending onto the amendment. This is not for everybody. So that's first of all. This is an effort to take a group of people for whom there has been nothing but frustration on the part of the people who care about them and the patients themselves, because as the chair of the work group just said, people not only have a right to live freely and have civil rights, they also have a right to live healthily. And when we were stuck in sort of voluntary, even recognizing that there are people whose illness prevents them from recognizing their needs, we weren't serving this group of people. And this bill starts to serve some of those people. So that's the main thing I want to say about it. And I know that you know, the proponents are not happy. The opponents began to scramble to start to make sure they had real input into the language because they were clear from your leadership that something was going to happen. And while I can't speak for them, my sense is that the bill is better than they thought it would be. And I think in another 2 years, we're going to find that what people realize is what we have is different from the other states. That we recognize the criticisms that we lack certain resources. And we tried very, seriously to work with the resources that we have and to make sure that the people for whom this fits are going to get quality service. I'm particularly proud of the report that we have that comes back and says, how are we doing? Are we serving? Who are we serving? How are we serving them? And where can we do better? So there are a lot of components to this that I think we should be proud of. And I would not be surprised if this becomes a model for some other states, because we recognize our limitations and that, again, that this is not for everybody with a mental health issue. It's not for every family who sees a crisis situation about to occur, but it is for some. That being said, on page 9, after 4 on F2, we have in the amendment, who has met with the respondent or has made a good faith effort to meet with the respondent and has examined the treatment plan. And I think what we also discussed, and I would ask for consideration, is that we add is familiar with the relevant history or something like that, Aaron. So it would read, who has met with the respondent or who has made a good faith effort to meet with the respondent, comma, is familiar with the relevant history, comma, and has examined the treatment plan. This is the psychiatrist who is making a recommendation to the court, petitioning on behalf of the petitioners. I think it's important that we clarify that they can't just know the plan without knowing the history that led to the plan, and it's not specific for medical history. They don't have to get medical records. They should have access to whatever information the petitioner and the local health department were able to bring. So I'm offering that.
I don't see a problem with that at all, so I would ask the committee to, unless anyone wants to discuss that particular amendment, let me know. All right.
Okay.
So you move the amendment?
I'll add that, Madam.
Okay, I second that, okay?
Okay.
All right.
And then the second one is on bill page 11 of 12. after 16 in D, it reads, "The county shall submit to the local behavioral health authority." And I'm thinking, a plan for periodic meetings with the court during the period. I think that should be, the court shall submit to the local behavioral health authority a plan. The local behavioral health authority is the county for this bill. They're overseeing all of the people in the AOT program. And I think what they're saying is that we want to make sure that the court is meeting regularly and that the oversight group, which is the local behavioral health authority, is aware of that. Am I wrong about that?
No, you're wrong about that.
All
And
right.
go
What-
ahead. You
what
want
is the
to, you
county?
want to address it? Yeah.
I think that the reason we put the county is because we're assuming that the county attorney, however they set up the plan, will be representing, so they need to come up
Yeah.
with a schedule, like it's quarterly, monthly, periodically, as to how frequently they're going to go to court, but the court wouldn't be the one setting that schedule, because they wouldn't know.
And Erin is nodding
from
her
the-
head.
Yeah, they wouldn't know from
I
the.
agree, and I'll probably move this section to earlier in the bill. So this would be when the county is asking for authority to set up the AOT program, and they, when the county asks the local behavioral health authority for approval, they would say, as part of their plan,
I
this is how often we'll.
Okay, so this is
that
not
will
for
appear in that
particular
plan.
client AOT. This is in creating the plan for how we're
Yeah.
going to carry
That's
out
correct.
AOT.
I
That's
really
correct.
feel like this
Got it.
section needs to
All
move.
right.
All right, thank you.
This
Okay.
was your
Thank you.
concern about what happens if they don't have a meeting for 8 months or 6 months. This was okay, they need to come up with a plan as to how frequently this specialty court will meet. So that's what.
Thank you for your comments. They were very good. I have Johnson, I have Bandari, I have Taveras, and then Kaiser.
This, as Delegate Bagnell said, this was 23 years in the making. And I really appreciate the whole team on the work group, all the hours they put in, and Erin is probably the happiest to see this bill finished. Because she really put a lot of work and so many changes. But this bill really addresses putting a team together to look after this small group of severely mentally ill that don't know they need treatment. Putting a team together that's going to look after those folks on the medical side, the treatment side, and their civil rights side. So I think, 23 years, it took a nudge, as Delegate Hill said, from our chair to really bring these people to the table to be part of the solution instead of just opposition and just, never budging at all and not getting together to come up with a true plan of how we could reach these folks. And this will actually help stop this revolving door in our hospitals and our legal system of these same folks. So I just want to thank everybody, and this was a really good bill to get worked out, to reach those folks, and I just appreciate everything that was done.
Thank you for your leadership, Delegate Bandari.
Yeah, thank you, Madam Chair. Since I was not on the subcommittee, I do remember wonderful hearing that there is always room for improvement in any healthcare intervention. Does evidence support that this is a good bill, but one of the point that opposition were raising on the individual autonomy and the civil liberty. I mean, Lisa, you are expert on this bill. Is there any wording or anything that shows, Erin, I'm sorry, oversight and safeguard thing, like the language there that can balance the need for intervention with respect for individual autonomy and the civil liberty?
May I ask Delegate Olston, who has been a leader on this, to address it? If I may, Erin, with all due respect to you. Go ahead.
Yeah, so one of the biggest issues was the the public defenders, right? They wanted to make sure people's rights are being protected. I think what we've done is, one, we've given them every single right that they would have if they were to go into a civil court. And we made it a civil proceeding, not a criminal one. So they, you know, they won't be incarcerated for not doing this. That was another concern. The other thing we did is we gave them every single right that they would have afforded to them in a criminal proceeding. So none of those rights are taken away. So they have all of the rights that they would normally have when they go through a court process. So that's in the bill. The other thing we did is we said, we're going to keep these proceedings under seal, which means you can't go on Maryland Judiciary Case Search and find out if someone is in one of these programs. You can't go down to the courthouse and say, give me, Delegate Bandari's file for AOT, because a judge would have to literally sign off to open that file and give it to someone that wants to see it. So only people who really need to know will ever know that this proceeding has taken place. That's a huge protection. And so I think, and then we also said that you cannot use this proceeding, which this one I thought was a little edgy, but you can't use this proceeding against someone in a future proceeding. So, they go to, get a job and they're in court for it. They can't then bring this up and say, oh, you were in assisted outpatient treatment and we're going to now use it against you. So I think we've given them so many protections, like every protection we could think of, just so that they could get the health care that they need. And so that's all spelled out in the bill. I'll give you the specific page numbers, but it's where we talk about the actual process. And then we gave them time to file the petition to get a treatment plan together. The opposition can file, the public defender or the private attorney can file an opposition to this. So they can say, no, I'm healthy. There's a reason why I'm not taking my medication, and here's what it is. They can oppose it. They can come in with their own experts to refute it. So we've afforded them every possible right that they actually currently have in any other proceeding in this. And so I think we've done a lot. And we've given them the highest civil standard that they have to meet, which is clear and convincing evidence.
Another point, I'm looking on the bill, page 6, that line 18. It says treatment plan includes at a minimum case management or assertive community treatment services and peer support services, and which is wonderful. I know this treatment are often in conjunction with the different form of therapy, medication management and support group. Is it necessary? I don't know if we could put the word medication management, that is also needed, or do you think that covers Erin?
I would like Delegate Wagner to address that.
We actually stripped medication out of the bill. It doesn't mean that it can't be part of the treatment plan, but we did not want to create a legislative intent that we would be forcing medication. So we were actually very intentional about being silent on medication in the bill, because we did not want to create a legislative intent that forced medication was part of assisted outpatient treatment.
Mm-hmm.
Also the therapy, yeah.
Again, the treatment plan is going to be individualized,
Okay.
so we didn't want to speak to what that treatment plan was. We wanted to speak to the minimums that the counties had to bring to bear in resources if they wanted to utilize this enabling legislation. And that care coordination team is actually really important. If you look at the national standards for assisted outpatient treatment and why it works, it's really, it's those ACT teams, it's the crisis intervention teams, it's the care coordination teams that are walking people through the process of their treatment plan. And so we wanted to, that's why that's what's outlined in the bill, because that's what really makes AOT work.
Thank you.
Yeah, you don't want to be prescriptive at all. I have rules at 9:45. Okay, so Delegate Taveras.
Okay, I'll keep it quick.
Yes, please. Please.
I mean, that was a message. I just have two technical points on page 6. Hold on a minute. Sorry, page 13. I'm sorry, page 13. I'm just asking is, line 1 says C and line 27 is E. Should that not be a technical correction? On page 13, bill page 8 out of 12. So line 1 says C, and line 27, after everything's deleted, says E.
I think handwritten 13, is that correct?
Yeah, it's right here.
So the top, the bill page 8, the bottom page 13, Aaron.
Yeah, relettering. Relettering E and F.
Yeah, it's just
Okay, so that's on 13. On 16.
So 1 second, hold on a minute. Aaron?
Sorry, I'm trying to follow.
So look at bill page 8. The top, bill page 8.
Uh-huh. Okay, I've got
Line
that.
27.
27. Mm-hmm.
Shouldn't it be D instead of E? Because
Yeah, absolutely. So that's a proofreading change that'll be made
And
as we
that follows
finalize
on
the
the next
amendments.
page too.
Absolutely.
And what is it?
On the next page, that F. it's the
And
same
on the
proofreading.
next page F, and she,
yes, of
she's, that's gonna be done with proofreading. Thank you.
Okay, and on 16,
Wait, bill page what?
bill page 11 of 12. Similarly, in section, after section A, it should be followed by B, and then there's two
Absolutely, yes.
Ds.
So
So
a lot
line
of them are
8
outdated.
and line
So they're
16.
absolutely
Yeah,
adopted.
so go ahead, Aaron.
Yeah, so those are technical changes that will be made after the committee officially adopts, but yes.
Okay,
they will.
those are the only two things that I caught that I was
thank you for
confused
pointing that
about.
out.
All right, thank you.
Thank you. So I have Kaiser and Rosenberg.
Thank you, Madam Chair. My question unfortunately goes back to something that Delegate Hill brought up on page 9 of 12. And it's not a proofreading thing, but when Delegate Hill was adding in that piece, again, on bill page 9 of 12, line 4, Roman 2, when you're adding in, getting the history, does that have to include some kind of language to say, if it's available? I mean, does it have to say to the extent possible? Because if that history is not easily received or something else, I just was
Actually,
wondering.
that makes sense.
Just so it doesn't become this, I mean, but I think Delegate Hill was suggesting that if it were available, it should be given, but I wasn't sure if it needed to be stated any such way.
To the extent practical, Aaron, can you add that?
Yes.
Okay,
Of course, yeah.
thank you. Delegate Rosenberg.
Thank you, Madam Chair. I just wanted to compliment the committee for the detail you added to the annual report. That it is not just perfunctory, but terrific. Because that shows this isn't the end of the ballgame. We're still going to be following this. And in that line, I think the judges have assuming the bill passes, they have a seminar, more than a seminar, but they're instructed on how to implement all the things we enact. And I don't know if it is appropriate to follow up on that, but by your nodding your head, Delegate Alston, you know better than I, it sounds like it is.
I think they're going to have to develop some kind of training for this. And I think that they will, because normally with their specialty courts, they have training on how to implement what the expectation is. We didn't want to put it in because we didn't then want the judiciary piling on.
Have they been involved, may I ask, have they been involved at all?
No.
Just asking.
But the public defender did a very good job representing their concerns with the timelines, because some of the timelines originally were like 3 days, 5 days, the court must do this.
Referencing the court's concerns or the public defender's concerns?
I think it was both, because they talked about the fact that the courts just could not do some of these things in 3 days or 5 days, which, to your earlier point about the 30 days, which is where we got that timeline from.
And again, the reason is that you don't want to criminalize this, right? And that's why we got to the table, the people that need to be at the table that deal with the individuals, and to make sure that their voices are heard, especially when we talk about civil liberties and finding a balance. It was we were intentional about that as well. Delegate Hutchinson, I didn't hear from you, and you were on the committee. Anyone else that I didn't hear from that was on the committee? I want to make sure I don't miss anyone.
Already, other than I'm thankful I was on it because I have a much better understanding about AOT now, and it was a good experience to be here and part of it.
Thank you. So I want to thank everyone for a wonderful discussion. Thank you, Aaron, again, for the amazing work that you did. And truly, you went the extra mile. I am so grateful and so impressed by you every single day. I want to thank the committee, the subcommittee, all the members for, leading. And Delegate Alston, I heard amazing things about your work. Delegate Woods, I'm glad I didn't start by asking you to speak first, because you would have to explain the bill. So I usually you threw me off there a minute by having your light on first, and I like to be fair. But in any event, your what you brought up was very timely and added to the conversation, all of you. And Delegate Hill, you did an amazing job giving the feedback. So I appreciate each and every one of you. So we're going to take a vote now on the amendments. Can someone move the amendments? It's been moved in second. Any other discussion? Seeing none, all those in favor say aye. Aye. Any opposition to the amendments? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, on the bill as amended.
Move the bill as amended.
It's been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, all right. Who actually does not want to be on the bill? All right, everyone wants to be on the bill. I just want to take a minute to say, for those of you that are home and were part of the process, I want to thank you, whether you were for it or against, or still against it. I want to thank you for being at the table and for bringing your perspective, because it matters. It makes it easier when we legislate. I know it's Friday before Sine Die, and I know that it will end up in rule, and I know that it will be tough to get it out. However, this bill will be pre-filed if it doesn't pass, and it will be one of the first bills filed so that it can have a proper, process hearing if we're not able to get it out, in both houses. So I ask you to please come to the table. If you have any more input to give, please do so. Please don't just say, I'm against it. It is simply the right thing to do. It is a small number of people, but they're worth it. They're worth having alive, okay? And having a chance, like Delegate Martinez's brother, all right? So this bill will go forward. If it doesn't pass now, it will be introduced early, pre-file, okay? Introduce. So anyway, I want to just thank everyone and thank you for all your efforts. The person on the floor, the leaders will be Delegate Bagnall and Alston, who are going to lead this bill and represent that beautifully on the floor with backup from Hill if needed. As well, Delegate Collison will have 363 and Senate Bill 806 on the floor. We may have to get off the floor and vote on a few things. We'll be flexible maybe this weekend. If you have any questions, let us know. Have a blessed morning. Delegate Taveras, do you have a question? No, just to be reflected on AOC. Okay. Thank you. Thank you. Have a great day, everyone. All right? Got it. Well, hold on a minute. We're not done yet. We're not done yet. How are you? Welcome to the committee. 1 second, guys. Go ahead.